Well, Mr. Nero, with Ohio facing declining tax revenues, what areas in the state government do you see the potential for savings in the next biennial budget?
Well, I think right now we have to look at the two biggest areas, healthcare and education spend. What are we doing in those particular areas to reduce our costs? $26 billion annually, $13 billion by each of those areas. What are we doing to reduce those costs? What I'm proposing with my bill, which is the statewide medical records bill, is the opportunity in which to be able to take a major step forward in creating a healthcare information exchange that goes across our entire state, branching out from our healthcare systems so that the information can be shared. We're going to block disastrous mistakes that are taking place in emergency departments when people show up and doctors have no idea who they are, to reducing redundancies for those multiple tests that are redone by hospitals that you go to. Again, the savings are estimated up to $1.3 billion by creating this medical record system. The urgency isn't in the State House right now. The urgency needs to be there. We also need to go back to what I talked about in education, creating a statewide system for earmarking dollars for education, but then putting the 612 school districts.
Thank you. Yep. Mr. Moran.
You know, all of us are facing challenging economic times. The state this year has had to cut back in spending by $1 billion. We're probably going to have to face similar challenges in the coming budget period. I am the one who has proven fiscal responsibility experience. I have helped our council, and I'm not the only one, and I wasn't taking credit for it, as my opponent said, but I've worked with others to cut back on our spending at the city level. We're going to have to do that at the state level as well. The way that we did it at the city level is we challenged our city manager to find ways to cut back by a certain percentage. The governor has had to make those decisions recently this year to have additional cutbacks. Again, priorities are important, and living within our means is important as well. I have the kind of budgetary experience both as a professional and as a public official to help us get that done as a state.
Can I have a rebuttal on that?
30 seconds.
Thank you. I should point out that as a healthcare and formerly an education industry consultant, I've worked with organizations around the country and around the world as far as South Africa to help them to balance their budgets and, more importantly, to reduce their budgets, to improve on the way that they do business, and then reduce their costs in the process. There are several city council members here from Hudson that would challenge Mike Moran's claims about his ability to balance the budget. There have been mailers that have gone out around our community where he takes the credit for that. However, he was part of the budgetary committee that challenged certain decisions that led to those savings, and there's someone in this room that would talk to that.
Could I have a rebuttal?
30 seconds.
Okay. I was not part of a budgetary committee that challenged any of the cutbacks. I was actually one when I was campaigning for city council who stood up at our Chamber of Commerce meeting and I said, here's the way that we're going to save money and become a more efficient government. Why? Why did I have this idea? Because in private industry, this is the way that we've done it. Year after year, we look at ways that we can become more efficient. I focused a lot of my career on improving the efficiency of systems and being innovative in how we do business. So I stood up and said, what we do is we tell the city manager there's a certain percentage we need to cut back.
Bell rang.